Okay, guys, so we are moving to the next route of drug administration, and this is what is known as an intra-arterial route of drug administration. Intra-arterial route of drug administration. So, for the intra-arterial route of drug administration, you can actually make sense out of intra, that's like inside. Arterial, you can actually make out the word artery from this, so an intra-arterial just simply means you are giving a drug directly into an artery. Now there could be so many reasons for that. I've not actually gone through this, but one of the reasons I could tell you that, let me say there's a cancers tend to like make up a lot of blood supply for themselves. That's angiogenesis. So let me say you now what is like a trap. Because they need a lot of blood, you now put the cancer drug right into the blood. Alright, so it's kind of like a way of trying to treat a lot of cancers. So intra-arterial route of drug administration involves what? Injecting medications directly into the artery, allowing rapid and target delivery to specific tissues or organs. So this method is primarily used in specialized medical treatments where a precise drug action is actually required. So you want this drug to actually do this, So uses of this intra-arterial, of course, I told you the first one is cancer, So you deliver chemotherapy directly to the tissues. The thrombolytic therapy. Let me say there's blood clotting all over the body and all of that. So you want to actually give a drug that will basically break down the clots. Diagnostic imaging. You introduce contrast agents into the arteries for like angiography procedures. Pain management, you provide localized pain relief in conditions such as complex regional pain syndrome. Right? So common drugs that are used or given directly into the artery include things like what chemotherapeutic agents like doxorubicin, cisplatin, thrombolytics like what alteplase, streptokinase, vasodilators like papaverine, nitroglycerin, contrast agents like what is what iohexol, iodizanol. Advantages is what there's targeted drug delivery. Of course, where this artery is supplying blood to. If you give drug into this artery, of course you are very sure that the drug will actually reach where you want. So there's increased drug concentration in specific areas where you need the treatment to actually come up. So it's used for what? Life-saving interventions such as what? Stroke management.